And welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Orthopedic Associates Center for Joint Replacement. And my first guest is Dr. Isidoro Zambrano. Welcome. Thanks for having us here.
Thank you.
Talk to us a little bit about who you serve here at the Center for Joint Replacement and what you specifically specialize in.
Here at Fort Healthcare Center for Joint Replacement, we specialize in shoulder, hip, and knee replacements. We're one of the actually the only hospital in the surrounding area with a specialized table that allows us to perform hip replacement via the anterior approach. There's approximately 70 years of orthopedic experience with my colleagues and I, and we serve the surrounding community here, and that's what we do.
Awesome, awesome. It's very good that you have such a specialized I guess, service located right here in Fort Atkinson. That's very cool.
Correct.
Yeah.
We try to give our patients the most up-to-date and state-of-the-art procedures as well as techniques that we go and learn and provide good care for our patients.
Always learning.
Dr. Zambrano, how do you determine if someone needs a joint replacement surgery?
Most of the time, it's going to be a patient who has degenerative disease. So, normal wear and tear. Normally you try to treat them with non-steroidal anti-inflammatories such as ibuprofen or naproxen, send them to therapy. We ask them to modify their activities, which also helps. But once that fails, then we indicate them for a joint replacement.
Like in my case.
So the joint replacement is really kind of like almost the last resort. You want to try to treat that pain and whatnot in as many different ways as possible before resorting to that.
Correct. Joint replacement surgery has gone through many hoops over the last several decades, and it's one of the most successful surgeries that orthopedic surgeons can give to their patients. Yeah. It provides pain relief, it restores their function, basically gives people their life back.
Yes, absolutely.
Dr. Zambrano, you mentioned the anterior approach hip. Can you tell us what that all entails?
Sure. Well, there are several ways to skin a cat, several ways to approach a hip.
Yeah.
Most surgeons will come in through a posterior approach, which is great. It's a good procedure. You can do it rather quickly. The advantages of coming in through an anterior approach is that you don't take down any of the muscles, so it's muscle sparing. You go through the muscle planes as opposed to taking muscle down. You can also use intraoperative fluoroscopy, which is an X-ray in the operating room to verify your position and put the implants in perfect position every single time. You restore their leg lengths, and there's essentially very minimal risk for a dislocation or any nerve injury that can happen with the posterior approach.
Intraoperative fluoroscopy.
Yes.
That is a mouthful. I'm glad I wasn't the one that had to say that.
So we use X-ray in the operating room to verify
Got it.
our component placement.
Since so many hospitals provide this kind of provide hip and knee and shoulder replacements, why do you really think people come to Fort Atkinson, Dr. Zambrano?
I think they come here because of the expert care that we provide, as well as a personalized touch. It's a very small community here in the area, and I think they just want to be treated as a person as opposed to a number.
That's fantastic.
We see them out in the community.
Yes.
And
you guys are part of the community.
Correct.
That's excellent.
They come back and visit us.
Oh, they do?
Yeah, they do. Linda has come back a couple of times to visit us and just show off her progress.
Yes. Well, awesome. Awesome. Well, we'll talk with Linda a little bit later in the show. Dr. Zambrano, thank you so much for the information. It was great talking with you. But don't go away. When we come back, we'll be talking with our joint care coordinator, Joanne Vels, right here on Wisconsin Doctors. Stick around.